Hi, my name is Jack Levy. I'm a chief resident at Emory University, Department of Dermatology.
Can you just tell me a little bit about your presentation?
Sure. So my presentation was a brief introduction to high frequency ultrasound of the skin. This is a little different from the traditional sonograms that we're familiar with because to image the very small lesions in the skin, you need a really high resolution. So my presentation showed some skin lesions that we often see in dermatology practices from like neoplasms, like basal cell carcinoma to scars. And our ultimate goal is to really see if ultrasound biomicroscopy, which is just another name for high frequency ultrasound, if that technology can eventually be used to distinguish a nodular scar from a skin cancer recurrence.
And what are some of the biggest takeaways from your presentation?
So the biggest takeaway from my presentation is that scars look very different from neoplasms. And why does that matter? Well, you can imagine a patient who's had a melanoma surgery, for instance, and if that patient develops a nodule in the scar, it can mean one of two things. So either the scarring is becoming too exuberant and what's known as a hypertrophic scar, or there could be a recurrence. So my colleagues and I are interested to see if ultrasound is the right tool to answer that question so that we can avoid biopsying scars unnecessarily.
Why is this an important topic for physicians to know?
So we all took an oath, first do no harm, and though we consider biopsies to be very minor procedures, for patients who've had a history of melanoma or other cancers, it can stir up a lot of emotions. So if we can implement a non-invasive means of reassuring the patient or saying, I'm sorry, but I really do think that you need a biopsy for this nodule today, well, then maybe we can help deliver the very best medicine that emerging technologies are really helping us to provide.